Welcome to Mental Health and Cybersecurity, What the Research Reveals. I'm Dr. Kashyap Demaraju, and in each episode, I talk with leading researchers to uncover how science can transform the resilience and well-being of the people who protect our digital world. My guest for World Mental Health Day 2025 is Dr. Subigya Nepal, Assistant Professor from the University of Virginia, whose research sits at the intersection of AI, digital health, and human-computer interaction. He develops AI systems that leverage data from everyday technologies like smartphones and wearables to better understand and improve mental health in real-world settings. His work is highly interdisciplinary, bringing together psychologists, clinicians, computer scientists, business scholars, and neuroscientists to tackle complex challenges in mental health and well-being. In this episode, we explore one of the most pressing issues in our field, burnout among incident responders. We discuss what motivated this research, the challenges of recruiting participants in such a sensitive area, and the key findings showing that more than half of incident responders experience burnout. Subigya shares why recognition and social support are so critical, how digital activity can reveal hidden patterns of overwork, and why addressing burnout must be an organizational, not just an individual responsibility. Together, we look at what these insights mean for cybersecurity leaders today and how future research and collaboration can help build healthier, more resilient teams. Let's dive into the conversation. Hi, Subigya. Thanks for being part of the series Mental Health and Cybersecurity, What the Research Reveals. Really honored that you're part of this as our first guest. I've come across your research, and so far it has been one of the most rigorous studies that I've seen on burnout and cybersecurity. So I'm really excited to have this conversation with you and talk about some of the research that you've done on mental health and cybersecurity, and also to get to know a little more about the research that you've done in the past in mental health as well. So if you could maybe for the listeners and viewers today, say a few words about yourself before we get started, that would be great.
Sure. Thank you, Kashyap, for inviting me. I'm super excited to talk to go through your questions, share some of the findings from my work with burnout, as well as in the past with mental health. Different groups of populations, both clinical as well as non-clinical general population, workforce, students, etc. So I'm currently a assistant professor at the University of Virginia. I just joined. I started like 4 weeks ago, so this is pretty new to me. Before this, I was a postdoc at Stanford Institute for Human-Centered AI. I spent a year there, and prior to that, I was a PhD student in computer science at Dartmouth College. And the focus of my research was mental health, AI, and passive sensing. Meaning, how do we use everyday technologies like smartphones, wearables, or telemetry data that we collect through, laptops, for instance, computers, to understand well-being better, to characterize well-being better? Can we identify behavioral correlates of what depression means, or what anxiety means, what burnout means? If we can identify these correlates, can we early detect them? If we are able to early detect these, then we can probably help people at risk. We could identify before before we catch them, before they end up in the far spectrum of mental health issues. And the way of doing that is, can we intervene on time? If we can understand what their condition is right now, can we help them before it gets bad? And we do that through the use of these digital health technologies. I completed my undergrad in Nepal. I'm originally from Nepal, and it just so happens my last name is also Nepal, so it's very apt. everybody questions me, hey, are you, using your country's name as the last name? Is it very common? Yes, it is. It is actually pretty common. Um, and I moved here in 2018, so it's been an, truly wonderful experience going through all this research experience, getting to meet folks like you, who are interested in, pushing forward and, human well-being, and technology, how technologies can be used in, you know, um, leading a better world, and so on. Again, thank you so much for inviting me, and I'm looking forward to contributing to this conversation more.
Awesome. Yeah, thanks. I mean, I think what I found really distinguishing about your research is that a lot of it has been in the clinical setting for someone with a background in CS. Um, at least that's what I found, especially with your research. That's quite outstanding. And it's also, I feel, reflected, with the rigor with which the paper that I'd like to talk about today, which is Burnout and Cybersecurity Incident Responders, Exploring the Factors That Light the Fire. It's a
Yeah.
very interesting title. How did you sort of get into, researching mental health? Like, was there any moment that got you interested in that?
Nothing, honestly. I mean, this is a truly rewarding experience to, pursue. You're doing something that, helps with human well-being. But a lot of researchers I've met um, have had personal experiences within their family, within relatives, which is, providing them this drive to push forward. But not for me. And I don't think you need to have a personal experience to be able to push in this domain, because it's such a rewarding, like I mentioned,
Hmm.
experience to be able to do something for, humankind, or, for the human well-being. So when I started out, my interest was in theoretical deep learning. That is what I wanted to do when I got into Dartmouth. The advisor that I was initially assigned, my PhD, who was supposed to be my PhD advisor, he was spending time at Facebook AI Research, what used to be Facebook AI Research back then. So I had like no research experience when I came straight into the university. I did not have research experience, and my advisor wasn't around, right? So I was like, hey, I need somebody who's here who can guide me. I don't want to be working remotely with someone and not, since I didn't have that, research experience at all. So I ran into this faculty who was leading the PhD student admissions. And I only knew their name, right? Because they replied to me after I got after I got admitted. That was the only person that replied to me saying congratulations. So that was the only name I knew. uh, so I just reached out to that faculty and I was like, hey, do you have any opening? My advisor isn't around, so I would love to work with you. And the faculty, Andrew Campbell at Dartmouth, worked in mental health space. For him, it was a more of a personal, reason why he was doing this. His brother, younger brother, committed suicide. He says the whole family was blindsided. He was just diagnosed with depression and bipolar disorder in his first year at college, and this was back in 2009. So that got him sort of interested in pursuing this area. Could technologies be a solution to what we're a scalable solution to what we're um, experiencing? And his focus was on student mental health. um, he did this student life study, the first sort of study that put together all of these sensing data from smartphone to track students, 48 Dartmouth students for an entire term, 10-week study, and try to predict their mental health, their GPA, their mood, and so on. So yeah, so I that's how I met him. And as I started working in this, I sort of you know started liking what I was doing. There's really it's not explored as much with generative AI. I think there's more focus on it these days. But back then, even when I started in 2018, it was a very small group of people. It's a small, I mean, everybody knows everybody kind of. Um, and yeah, I just started by accident, and then started liking what I was doing, and then just continue on this path.
Awesome. Awesome.
Yeah.
So let's start talking about the research that you did, burnout in cybersecurity, incident responders, exploring the factors that light the fire. And this was published at, I believe, ACM, Human Computer Interactions, CSCW.
Yeah.
For those who don't know about this venue, could you say a few words about it? Like, because as far as I understand, it's a very prestigious venue.
Right. So this falls under a umbrella term called human computer interaction, which has several meanings depending on what you're working on. So building new interfaces, like new ways of interacting. If you've seen the new, Meta glasses, the band that they have, and you interact through the band, that comes under HCI as well. Social computing, which is what this is comes under a human computer interaction as well. So there's several definitions of these. CSCW is a top conference for human computer interaction. Um, it's The full form is computer supported collaborative work and social computing. So the early focus of the conference was in workplaces, like work specific papers or publications. But then nowadays it has switched. I mean, later on they switched it to include also social computing. So a lot of work that does with social computing that doesn't necessarily have to be work itself, but still it is the primary venue if it's something related to workspaces that your work that the work is about. Um, so yeah, it's a mix of computer scientists, psychologists, behavioral scientists that are working in this future work sort of domain, but also social computing in general. And it is one of the premier, I would think, um, top three sort of conferences in HCI.
Hmm. Awesome. Awesome. Okay. So, um, can you tell us about the motivation for the study? Why did you and the team go ahead and pursue this? And like, what were the goals that you have? What were the goals you had for the study? And you also mentioned it's more explorative. So,
Yeah,
could you say a few words about that? Because I know the author list is like super
right,
long, and it's
right,
yeah.
right. So when I started this, I did not know about the problem per se. I was a student, PhD student, and I was doing more clinical sort of work with students and also with workplace as well, but not specifically about cybersecurity. So this sort of study came up, as you said, like there's a lot of co-authors on this one. So the idea was planted by the last two names that you see on the paper, which is Mary Sarvinsky and Hema Prafulchandra. Hema was CTO at Microsoft, and Mary was the lead of the team that I work with in Microsoft Research called Human Understanding and Empathy. Um, and the whole motivation was there's a huge burnout crisis going on with in several cybersecurity domain, specifically with incident responders, um, right? And even within our study, we saw that more than half of the population that we studied, that we recruited, had or scored high in burnout, with exhaustion being the most prominent symptom. Now, unlike other professions, there's been minimal research with cybersecurity professionals specific to incident responders, um, specifically since there's such distinct stressors or unique stressors like 24/7 threat landscape, high stakes decision, and constant vigilance requirement. So our goal was to move beyond these anecdotal, sort of evidence that you can read on websites and so on. And some studies have used, for instance, recruited participants through Prolific, recruited participants through Mechanical Turk, but you don't know if these people are who they say they are, right? Can we study actual incident responders, security incident responders, and try to characterize the problem, not just using the subjective self reports, but also objective digital activity data, right? That was the goal. and we wanted to come up with these actionable, goals for an organization. What can the organization do to help with this problem? Now, that said, there was a lot of challenges in recruitment itself.
Yeah.
Uh, so, which is why you see only 35 people in the study. But compared to what's there in the literature, I think it's still, a comparable number. It's not too bad, I would think. Uh,
Hmm.
but yeah, I would say that that was the goal of this study, to try to
I
sort
see.
of characterize the problem with both subjective and objective data.
Hmm. Yeah, and I think also the point on including digital activity is also something that adds another dimension to it, that usually if people were to look at this, they would just like have a survey, and then say, yeah, okay, there are so many people who have burnout, but then correlating that with their digital activity, because I think there are some interesting findings that you all had on that with like
Right.
email and meetings and so on, which we could maybe touch upon later. But yeah, I completely agree with you on the research aspect. So from the literature I've seen, it's only from like 2015. 2015 was probably like the first study I've seen on studying burnout in security operations centers by such Sundaramurthy and his colleagues, where they came up with a model for burnout and this vicious cycle and virtuous cycle for what causes burnout in security operations. But I think in this paper, you guys focused exclusively on incident responders. And I also agree with you. There's a lot of like anecdotal evidence, or people have done like surveys saying, yeah, okay, do you feel burnt out? Do you feel stressed out? And report that, but not having used psychologically validated scales, or in certain cases, clinically validated scales to actually measure this, is what I think is also like distinguishing in this research.
Right. And
Um,
just
yeah.
to mention, we also had, we had experts in the team. We involved stakeholders. We involved, security managers that understood, like some of the authors in the team, as well as, experts in human factors and well-being and psychology, such as my mentor Javier Hernandez, who I was working with. Raul Rojas, who is the other author, is a security manager himself. So this the list of names that you mentioned, we sort of have people across the different teams that um, help make this a reality.
Hmm. Yeah, and I think what's also interesting is that um, this paper is not just about the burnout aspects, but you guys also looked at the other aspects of well-being and engagement, which is also something I think quite important, because when we look at burnout and cybersecurity or mental health and cybersecurity, there's so much emphasis on the negative aspects of like, yeah, stress and burnout, but not so much on, the other side of things like the well-being and engagement, and so on, and sort of like showing that actually there are people who find meaning and purpose and who are also having a sense of well-being.
Right.
So I like this sort of the both sides of the coin
Mhm.
in this study. And I've also done some research in this space, and we've also looked at that. And I can also agree with you, like on the state of mental health. Yes, there is burnout, and yeah, let's go into it a bit more. So like, maybe before we go into some of the findings, could you touch upon maybe some of the challenges that you
Sure.
encountered during this study? Like, you mentioned sort of recruitment was one
Yeah.
of the parts. Were there other aspects to it that made it challenging?
Sure. Yeah, there were in fact several aspects. Now, recruitment, obviously, like I mentioned earlier, like cybersecurity folks already overburdened with all this work, and truly what they've been taught is to be skeptical about everything that happens, right? So uh, we would get questions like if this was phishing attempt, whether it worried about operational security and so on. So from recruitment angle, it just was very difficult to get participants. because they were questioning all these, and that's what the organization has been working on, right? They have been working to so that people don't click on these links, right? So it makes perfect sense for them to not want to do this. There was a trust barrier, I would say, and I mentioned this in the paper. And then folks prior to me who've done research, like the authors that you mentioned earlier, have also brought this up, right? That hmm, because how the team has been taught to question everything, um, there's you need like proper tie-in, or you need proper buy-in from the uh, team to be able to recruit participants. So it's really challenging to do that if you don't have like a basically they consider you an outsider if if there's not proper buy-in, and they wouldn't be ready to share this data. That leads to the trust barrier question, because and other studies have brought this up, which is uh, the way academics work is different from how these folks are working. And I say that because currently we're seen as more like trying to push our career forward by publishing these papers and moving on. There's no real reason for people who publish to try and make a change. It's all about publishing, like trying to get some credits and then moving on. It's not really going to change anything for them. In fact, I got an angry email from one of the people we reached out to, saying it's pretty tone deaf to try and do this when what their email said was, you already know it's a problem. Why are you trying to, you know, get people to think about if whether it is a problem, because we know it's already a problem. It is pretty tone deaf for you to try and do this instead of actually helping these people, right? We need a solution right now, is what they were saying, rather than you trying to do a study to characterize this thing. I can understand where they're coming from, but from purely scientific sort of angle, like I mentioned earlier, there are anecdotal evidence, but there was not a systematic study done, I think, to understand this, really, to characterize this, incomprehensively. So there is that. There's the sensitive data concerns, like how open would be an organization with, sharing these sort of information and having it published. There's always the question of, could this be used by a, threat actor to sort of, perform social engineering or something, for instance, right? Could this be an actor sort of, could this be a thing that helps, them with their attack or whatever, right? There's that concern. And one of the things I mentioned in the paper is the superhuman mentality, or Superman mentality, which is there's this cultural resistance to admitting struggles, right? And it's usually seen as weaknesses in field that values technical prowess, right? So I would think that I would list these as the major challenges we had in sort of recruiting these participants. But basically, it's a difficult population to get access to due to clearance requirements, due to time constraints, right? Um, and yeah, it's basically a very difficult population to get access to even start, any sort of study. So I do think like there needs to be proper buy-in, like tie up with organizations before you can do something, like you can do a large scale study um, um, like this.
I see. Yeah, that's actually quite insightful. And I also agree with you. Yes, the paper from 2015 from Sundarmurthy and his co-authors also mentioned something that they had to actually be part of the SOC and build trust with the people before they could actually open up. Um, so would you say then, like from your experience studying mental health among different populations, this is actually quite different, like getting access, yeah,
It is.
like
It is.
other. Mhm.
It is. So when you think of general population that I've worked with, students are usually the convenient sample, right? Of course, there's mental health issues, well-being issues around students, but they are generally more easier to recruit because most of the studies come out of campuses, college campuses. So you're recruiting students either for research credits, or you're paying them or something, right? So it's and you can get access to large population. The clinical population depends on what sort of clinical, disorder you're going for, right? So we've recruited participants online. You could put up Facebook ads, you could put up Google ads, and people search for, say, you target certain keywords like depression, people search about it, they see your ad, they recruit themselves, right? There's certain selection bias going on, of course, here, because the assumption is the person in the study knows how to use these devices, knows how to search Google, how to sign up to these studies, which is not true all the time. That is when you try and recruit from, and that is when where it is a problem if you're dealing with maybe a population that is not digitally literate, for instance, right? So we have studies, for instance, where we're hiring or recruiting, sorry, not hiring, recruiting participants from boarding care homes, for instance. In those cases, you need to have right collaborators, right, who have access to those, boarding care homes patients. Maybe these are people that you regularly see, the collaborators regularly see as therapists, and they, help recruit these participants for the study. But to get access to that particular pocket of population, you will need to know the right people. You need to go through the health system, the hospitals, and so on, as opposed to recruiting people widely through internet, right? Because that's not the whole, like that is not representative of the entire, population, especially people who are not digitally literate. Um, with workplace, um, it is sort of, we have partnered with every uh, study we've done, we partnered with the organization to recruit participants. So the organization would share flyers, like put it on the notice board or something, like, hey, this and so study is happening, we don't get any access to the data, and so on. But they are much more open in that because this is I think the stakes are lower, like you're not working with a security group. um, so it is more accessible than getting access. I mean, it's really hard to get access to the part of the company that works with security, right? And in fact, the
Yeah.
frontline defenders too, right? These are folks that protect were the front line against the attack, right? So it's
Yeah.
very difficult to get access to this population. So I think in terms of other sort of in clinical domain, it's about, do you have the right collaborator who already sort of sees this population. um, but in terms of security, I think um, it's really hard to have somebody like that, like a collaborator who has access to this population, because the whole point of organization would be to not give you an access to these people, right? Because they protect the organization from attack. So I do think, like, even though there are challenges in clinical recruitments, it's not as big of a challenge as it is with security sort of research, I would say, based on my experience.
Okay. Okay. All right. So, yeah, thanks for sharing some of those challenges. I hope this would, by talking about some of these challenges, that might open sort of the minds of people who are in security to be a little more receptive to such studies, and also to encourage, let's say, stakeholders and decision makers
Right.
who become aware of this situation, to collaborate with people who want to do such studies, because I think that's super important. We also have
Right.
a grant under submission where we want to look at this conditions and understand it better, to come up, like, identify what are the factors that are causing this and what we can do to actually
Mhm.
improve it. So yeah, thank you so much for sharing these challenges and, like, from your own experiences.
Right. And I would also mention that the fact, like, many of these studies take place is like you're paying sort of rewarding people for taking part in the study, which students are readily open to doing that. Clinical population, they do it out of kindness of their heart, like they have this shared pain that they don't want people to go through something that they've gone through, and if sharing data or taking part in the study helps make that happen, they're much more open to it. I would think the security population would also have sort of like the same sort of experience, but then there's no like the reward aspect does not really play a role here because they're paid really well, right? They're
Mm-hmm.
not taking part in this study so they can make more money, or they're getting a phone or wearable out of this study, right? um,
Mm-hmm.
I'm sure like they want to contribute. uh, and when this study took place, there was a lot of there were a lot of people who were really interested around it. It's just that the organizational like the collaboration aspect is really important. Like the organization has to be open enough to sort of try and want to do this. The reason this also makes it challenging, sorry, one of the reasons why it is also challenging is because of the outcome. With a lot of studies that we do with students and clinical population, even with clinical population, they're sort of uh, like finding out something is the outcome, uh, but then there's no like immediate responsibility as such. But then if you're doing an research with an organization, and organization knowing that there's, burnout is a huge factor, what are you going to do about it? So liability becomes a huge issue. And that's one of the reasons I learned that organizations try to stay away from this, is because, hey, okay, now people are burnt out, people are stressed, people are leaving the job. What are you going to do about it, right? And if you're not liable, right? Are you opening yourself for another, are you going to get sued? Is this going to be another, reason we should steer away from this? So that sort of like um, question is also there. And I realized that's one of the reasons organizations might be not open to doing this as well.
Mm-hmm. Yeah, that's actually an interesting point because this is also something I've been thinking about, which is I think that decision on whether they're going to act on the findings probably aligns with the values of that organization. Because
Mhm.
if they actually care about their people and they're observing this and they haven't actually cared about their security people so far, it might be a wake up call to actually take action. But if it's an organization that actually doesn't value or care about their people, they're probably not, they're unlikely to participate in such a study. And then if they get to know such information, that's where the risk is. And I feel like organizations who already care about their people and value like their people, um, chances are we probably don't see these situations, or the percentage of people who experience burnout are probably low. So it's yeah, it's kind of strange. I feel like the people who might need the organizations who might need the help are the ones who are not participating and won't act. So it's like, how do
Right.
we get these organizations to change? Which is, I think, yeah, something more fundamental in some sense. Like, how do you get their mindsets to change and so on?
Mhm.
Um, okay, so let's move over to some of the interesting findings that you have from the study. So, would you like to share um, some of like starting from a high level and then maybe going down into some of the details about what you all found out? And maybe first of all, perhaps tell us, or maybe I can sort of like just highlight, the extensiveness of what you all looked at. So. Um, if I look at, one of the tables from the paper, I think it's table 2, where you looked at the different aspects, the categories. You looked at well-being, you looked at job demand, personal resources, social resources, job content, digital activity. These were like all the different categories. And within each of these categories, you had like subcategories, where you looked at sleep, depression, work engagement, personality, emotional regulation, resilience, teamwork, recognition, job security, work-life balance. And then with the digital activity, you looked at calendars, uh, mails and messages, and weekend work, and so on. So there's definitely so many things, and I don't expect us to like touch upon every single thing today, because that's like, I would suggest listeners and viewers to actually go ahead and look at the paper for that. So maybe you can like talk to us about some of the key findings that you think that are interesting and valuable for individuals and the organizations.
Sure. So I had a chance to design the study. So I was like, I went out and I included everything that I found in literature, just sort of played a role. And in fact, there are things that were not included in the paper that we did, but we could not release because it was more of a security concern, or, something that the organization was not okay with. Um, so I think the major major finding would be that even though the sample size is small, um, it is representative enough uh, that half of the population we studied, more than half of the population, I think 55% or so, is experiencing burnout, and on the clinical spectrum, like clinical burnout, uh, not just like on the lower end of the spectrum. And most of them, and their burnout has four different dimensions. Well, different dimensions depending on what sort of surveys you're using, or what sort of conceptual model you're relying on. But based on what we used, like four dimensions, and exhaustion being one of them, and most of these people scored high on exhaustion component. Um, so I think that is like the measure, sort of broader out, like finding from our work, and it sort of aligns with what other research has found, that majority of people are burnt, like incident responders, security workers are burnt out. Then when we look at specific items, we find things like burnout group working more than 40 hours per week. Some, in fact, have reported 60 plus hours, and significantly poorer sleep quality compared to non-burnout participants. And objective data validated these self-reports, which is really cool. There's when you find agreement in what people are saying and what exactly is being, gathered through this, collected through these um, computers. So we saw that burnout groups sent more emails. They sent more emails after hours, both during work and after hours. They had more non-quiet days, meaning um, compared to people who were not burnt out, they were working more after hours. So, and they had fewer minutes of weekend recharge time, meaning they were still working on weekends. So basically, they did not get enough time to recover. All this points to that, right? And one of the most interesting thing I take away from this is um, about recognition. So only 26% of non-burnout group reported that they did not have any recognition in the past 6 months, whereas 74% of those who belong to burnout groups, meaning that fail on the upper spectrum of that cutoff score for burnout and non-burnout, um, 74% of the participants who reported that they were burnt out said that they did not receive any form of recognition in the past 6 months. And this is not just monetary reward, right? This is like a congratulatory email from, great job email from your mentor or manager, whatever, could be as small a thing as that. Um, Now, this is not to say that, you know, um, it is because that they were not recognized that it could have led to burnout. It could very well be the other way around, right? It could be we don't know what the direction is. It could be that you were burnt out, you were making mistakes on the job, and then you didn't get recognized for that reason. Or it could be the other way around, like I said, you're doing a great job, but you're not getting recognition, and that just added to burnout, right? So we don't know what the direction is like, but it is interesting that that's one of the major differences we see in self-reports across the two group. Um, so I would say the measure, research perspective I would again reiterate here is there's a convergence in what self-report finds and what digital data sort of, validates from this. And recognition and social support showed strongest association. Um, and we know that these are organizational factors that you can improve on, right? Um, and work-life boundary violations, where we measured these through the telemetry data, and they're still validated. These were validated with these digital activity data, like working after hours and so on, conflicting focus hours, private meetings, a lot of more private meetings. Maybe that indicates that people who are burnt out, they're attending, maybe they're dealing more with these high incident tasks than people who are not burned out. We unfortunately could not record, like, could not get access to the, due to security reasons. Obviously, you can understand, like, we could not get access to the incident response or management tool. Uh, but we did ask participants to sort of report that um, anecdotally, and that was a limitation, which is why we didn't include that as part of the study. So we had much more data than what we presented on the paper, and it was so much challenging to sort of decide how to put this together, because there's so many items, and if you go on reading the paper, it's there's too many things to just keep track of. But I still think it's like a good foundational study to sort of build off of. um, yeah, but I would highlight these as the major sort of findings from the study.
Absolutely. I think this is quite foundational because there are so many dimensions that you've covered, like looking at their well-being, sleep, depression, um, their digital activity, and so on. So I think there's definitely a lot of scope to build on this. We've also cited this paper as motivation for what we want to do further to sort of understand this, um, like get a better picture of what the situation is and what we can do. So we talked about exhaustion, or you mentioned exhaustion, and that's also something I can also confirm from one of the studies we've done on. So we use the Copenhagen Burnout Inventory, which measures exhaustion, and there too we see a lot of people experience a lot of exhaustion. So um, let's see. You touched upon working longer hours. I also saw that the burnout group also has poorer sleep quality. That's also another observation, and that's also, I think, something, because that's so important. Sleep is like one of the things that we just do, and it recharges us, which is actually amazing. Like just by closing your eyes and shutting off your body, you get more energy, which is amazing, and that can also help.
Yeah.
I would have been also interested to know like what the impact is on the incident response, like let's say security outcomes or the metrics and performance. But I think that's something that you mentioned where maybe that was a little challenging to get access to. But I would imagine that would actually give more motivation and weight to the findings, right? To actually show quantitatively, hey, this is what the people are experiencing. This is how it's impacting your organization. Do something about it in some sense.
Right. So this was like a high risk data to
Mhm.
share how many incidents the organization receives and how many are addressed by these people and so on. So we could not actually work with that. We asked people to self-report like different levels of incidents they worked on, um, how sensitive it was and so on, but we could not sort of analyze that because of this security reasons. So yeah, it would be great to have that, I think, in the next iteration of study, a longitudinal study that actually takes into account even more information than that is as
Mhm.
the part of this study. um, and I think that could be a great use case of, if you ask me what's the next level, right? What's the next step for this work would be, could we build something, for instance, there's copilot, security copilots, there are like tools that use a generative AI to sort of mark how sensitive or how high risk this how risky these uh, incidents are. Could you assign these based on somebody's workload already, right? Or all these tools take into account external state, right? Not the internal state, or proxies for internal state, I would say, of that particular person, right? Whether they're stressed, what's going on, so on. If we can take into account both internal and external and assign these works based on that, um, could 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 that be a way to manage burnout, right? So I think that that could be the next step of this work if we were able to get access to incident reports.
Mhm. Yeah, that's an interesting idea. It's sort of like this dynamic or adaptive workload management
Right, right,
concept. And
right.
that's one of the topics that also came up through, I think, some of the qualitative responses you got
Mhm.
from them. That workload was like one of the major
Right.
challenges that they occurred. Like it could occur at any time, or then they're just like overburdened, and then it's not prioritized. They don't get help prioritizing their workload and so on.
Right.
So I was like curious, like how does that fit in? Could you say a little more on um, about that?
Sure. Now, I don't know the, intricacies of how it is actually implemented in, cybersecurity domain, but um, I I think I was thinking maybe if we ever have these tools, these wearables that observe, that get objective data on how we're feeling, then we have access to how many, incidents or what kind of incidents the people are, specific people are or have worked on in the past. Could these workload management sort of tools? And I think there's also another called fatigue management system, which is used in aviation. And there was a workshop that NSA did that also came up with the suggestion that with cybersecurity folks that came up with the suggestion that we need to have a fatigue response management system or something in that regards in cybersecurity domain as well. Now it may look like maybe offering rest periods, mandatory time off, um, offering one of the things that people brought up was they never get time to keep up with what's happening because there's what's the latest and recent stuff that they get that they should read up on because they're so busy addressing all these issues. Could these be an intervention? Could this be a recommendation that take time off, take rest period? Um, you know, I don't know, like could this be or change the kind of incidents that you target next? Uh, while I say that, I would also mention that we don't know if how incidents relate to burnout, though, right? I don't think there's been enough study to say that okay, if you do highly sensitive sort of work or highly demanding sort of priority wise high demand sort of work for these many hours um, or these many times, then it leads to burnout or such. So we, I think we first need to have a fundamental study on that, like how that relates to burnout. Um, but maybe this is something we can learn from healthcare, right? Healthcare has been studying burnout for over 5 decades now. Can we learn what they know about this, right? High demand sort of work. Maybe we just, use that learning instead of having to, do our own. There are things that are translatable, I think, transferable from healthcare to cybersecurity, but then there are things that makes cybersecurity job unique. Um, for example, people, and I've mentioned this to you, I think a couple of times, where people compare security job with what firefighters do or what healthcare um, folks in healthcare do,
First
which is
responders and
yeah, which is, demanding job, and you have to be on call and so on. But one of the things that's unique with cybersecurity in particular, I think, is the adversarial nature of this. So there is actually a malicious actor that is trying to do something while you're working on it, right? It's not like fire is not malicious, right? Or health, if you're working in like first responder in healthcare, there's not a malicious actor that's actively trying to go against you, right? um, how does that play a role in what you're doing, right? So what factors does it add that makes it different from how you would have dealt with things if it was from a different domain in healthcare or firefighter or other kind of high pressure, high demand, 24/7 on call kind of job, like call centers and so on. There's no, I think that in some aspects it's different from whatever we've worked on or know about from past studies in different domains. So I think there are things maybe that we could learn and sort of adopt here, like fatigue management systems. But I also think it's like some aspects of it. You could say like it's an beast of its own. So um, I don't know what the intervention would look like, but I think using generative AI is the first step. There's tools like I mentioned that assign jobs or categorize jobs, or even go far as like replying or try to solve these if these are like minor things. Uh, but can they help with recommending what the person should do? Um, yeah, that would be something cool and something I'm interested in exploring, frankly.
Interesting. I think like one of the points that really caught me was on how you mentioned how many incidents like does an incident responder work on before they reach some threshold. And I
Right.
think that threshold depends on, let's say, the personality or that particular person's, I don't know, state. Because I recall one of the other findings that you had, because you'll also looked at personality, where you'll found that I think people who are more extrovertedness, they were the group that were probably more susceptible to being
Right.
burnout than any of the other factors. So like
Yeah.
it's so multifaceted over here.
Yeah, and that's a great point actually, and it is great because um, prior studies have found the relation to be the other way around. Introverted people were more prone to burnout, but here we found extroverted people are more prone to burnout. Um, I don't know if it's just with the
Hmm.
specific sample that we're studying that we're
Yeah.
it's just uh, there's no real validity or truth to it, but it is interesting and it's worth exploring if, you know, this population could be different from what we know about burnout from other sort of uh, domain that we've studied. You know, so yeah, it is worth, I think, studying in what ways like this population is different and whether interventions or things we've tried in other sort of domain could be apply them here.
Hmm. Yeah, and I think this whole concept of managing workloads, using AI or not, and helping people identify for themselves also how to manage their workload, um, and regulate themselves or like maintain these work-life boundaries, because I think that's also something challenging
Right.
that they face.
It is challenging. It is challenging, and I think a lot of research tries to put the blame on basically the individual, not necessarily the blame, the more responsibility on the individual. Like you mentioned earlier, like personality plays a role. We've looked at resilience, for instance, and resilience obviously plays a role. Uh, but then we also don't know the direction of it, right? Is it burnout that, if you're resilient, you're less prone to burnout, but how much s- should you be how much must you be experiencing burnout before your resilience, like what is the breaking point, right? uh, and in this particular study we wanted to look at all those factors, which is why you'll see a lot of organizational factors as well. And we see like things like work-life balance, um, um, like boundaries, work-life boundary or work boundary violations, um, job security, recognition, right? These kind of things is something that the organization can definitely improve on, right? It's not
Yeah.
up to the individual. Well, maybe in some regards, but it's mostly, you know, uh, something that an organization can do well, do much better in, right? Um, so I think there is obviously like an individual aspect to this, but then the organization should be much more responsible than an individual for this, to I truly feel like to address burnout issues. It is challenging. Like one of the recommendations we have in the paper is, recruit more people, right? It's sort of a catch-22. Like the reason there's a burnout is there's no enough people, and then I'm saying like the solution to this is recruiting more people, but then we don't have, right? So just throwing it's not a numbers game. Like you throwing people will not solve the issue because it's a I think that's not the major reason why this is happening, um, or how we can. It would probably work for the time being, like for a while, but that won't be the solution. Um, that would really solve it in long term. Um, so I think truly for me, I think there needs to be more longitudinal, sort of studies trying to identify relationship between different factors, um, explore what are the different interventions that we could use, effectiveness, whether this is mandatory rotation, like we talked earlier, the rest policies, recognition programs, and so on. Um, and also look at um role specific uh, manifestation. Like, does burnout look different for SOC analysts versus frontline workers, like incident responders versus forensic analysts, and so on? Because I do feel like all of these different population or different groups may have like different you know um, things that are you know um, there are things that would be cross-cutting that are common, but I do think there would be like more uh, group-specific sort of things as well as we start studying these several pockets. Um, and like I mentioned, how can we use technology in this, right? Uh, uh, yeah, this how do we deal with fatigue and all is um, alert fatigue, for instance, has been studied for along with even cybersecurity folks, right? Those who work in IT specifically. So yeah, I think there's a lot to be done here.
Hmm. Yeah. So, um, I know we're coming slowly close to an end for this recording. I have a few, just a last few questions for you. So, um, like based on let's start with this because let's continue slightly on what people can do, or what we can do, or what could be looked into further. So, given your background, in AI and LLMs and productivity and mental health disorders or conditions, what would you suggest for people who want to, start researching this, or like get into this field and try to find like small wins, or maybe even like a long-term goal? What could be like simple or complex follow-up studies or questions for people to interested in this to improve the productivity and well-being of cybersecurity practitioners?
Yeah, great question, and that is something I'm interested in exploring as well. So if anybody's interested in collaborating, please reach out. I think the first thing is to find collaborators, because this is not something that you can build an algorithm and say like, okay, I got a performance improvement of so and so, because um, like we don't have data basically. And if you want to study the right population, you need to get access to the right person that has access to these population, right? So finding out collaborators would be the biggest challenge, I think, to get access to the population. I would think the things that I mentioned earlier, like even studying niche sort of groups within cybersecurity, like SOC or forensic analysts or frontline workers, I think that is one way to go about doing this. Um, I think there's certainly value in trying to do that. The other thing is conducting a longitudinal study, basically trying to characterize like how we did, but could you do it in a longer term fashion, right? We had like 6 months of digital activity data, but we collected that retrospectively, right? If you start now and you haven't collected data prior to this, run a 6 month study, a year study to see if you can pinpoint when the change happened, what the baseline looks like, and when do they deviate from the baseline. That is what we want, right? What actually led to that, so we can identify the causal aspects of what actually happened, right? But even before that, I think we still have so much to do correlationally, so just characterizing what the relationships are, that I think uh, even like correlational studies like ours, like what I did or what we did with Microsoft Research, I think there's still value for those kind of work as well. Uh, the other I mentioned earlier, cross-domain comparison, like what has been done in health domain or um, call center stress, for instance. Are there things that we can learn from that, right? What could we adopt here? I think that is also a nice way to like go into more interventional aspects of it, without having to wait for an observational study that can be conducted. What if we do an interventional study, but we borrow ideas from what has worked successfully in other domains? I think that could be a small win as well. Um, Building these systems is another, depending on what particular area you're interested in building these uh, fatigue risk management systems, or using AI agents. Can you use AI agents to reduce cognitive load? Um, that would be an interesting domain. The challenge there is we don't know if it'll bring in new stressors when you're trying
Yeah.
to use AI agents. As with all things we've seen, like social media, right? So social media, uh, it came with a lot of advantages, but also disadvantages that we learned later on, right? So new
Yeah.
stressors that it brought up. Same things with AI agents right now. There will be a solution to a lot of our problems, but they will probably also bring new stressors with them that we have to be mindful about. At least from the learnings that we have from social media, we know that every time these technologies come up there, they always bring something with them, right? They would be good, but they would be bad as well. The sooner we know how to, so the sooner we can address them, the sooner we can, the better it is. So these are some of the things I think that could be done. But the most challenging um, problem, I think, is still finding collaborators, like getting access to the population to study this, having someone who's open enough to sort of diving into this. Um, yeah, I would say, like off the top of my head, I think these are some of the ideas that I think um, that are that may be worth pursuing. Now, all this said, it is intervention, I think, with specific to the population is also very challenging to do. So as a whole, it is a really, really challenging problem to tackle, but that's what makes it fun, right? It's a hard problem, but if we were able to sort of try to manage this, I think there's a huge benefit to be reaped from it. So, yeah, those are some of the ideas I have.
Awesome. Awesome. And maybe one more question is on, was there anything that you specifically learned from this study that you did that you leverage or have leveraged in your research after that? Was there like a takeaway that you can now like make use of?
Sure. So I'm a quant researcher. I don't do qualitative work, or hadn't done qualitative work prior to this. So this was my first, I think, qualitative work where I actually interviewed people. I mean, interviewed people which did not make part of the study as an interview code, but there are part where participants responded to these qualitative questions that we have highlighted. So that was one of the learnings. You know, no matter how much data you get, however much of quantitative analysis you do, right? This qualitative data provides a story, like adds color to what you've done, right? So it was, I and then the follow up, like the other kind of work that I did, I ended up, interviewing people, try to get their perspective. So that was a good learning. Um, so digital activity data, for instance, here revealed that if it was just digital activity data, it would reveal that they worked after hours and so on, but then getting that validity from participants as well, why they're doing what they're doing, right? So how the work is exhaustive, exhausting for them and so on. It made the work more um, more personal, more, I think, added more color to what we found rather than just having numbers. So that is something like mixed method setup work. I've started doing more of that following this. And the other thing I learned was, well, I had my doubts, but triangulation is important, right? We have self-reports, we have data. So the data alone would miss why. Like we see how something is happening. So the why would be like self-reports, right? So putting them together would be is how you get the whole picture, sort of 360-degree view of what's actually happening, right? Um, then the other thing I would mention is role-specific research. It's important to sort of study, like I mentioned earlier, different roles, I think, to understand different trauma exposure demands of the job, um, and the importance of temporal patterns. So we could look at a single number, like total number of hours they worked. But then if you look at, when does that happen? Is it after hours, right? Or what specific period of time it goes on for? So I think that is like one of the interesting learnings I had out of this work. Um, and it translates very well to what I do because I build these systems that collect data um, from phones and wearables, and people go about their everyday life, right? And it's super noisy compared to what we got from this specific study, because the data that we have from this study is limited to your work, right? The digital activity data is limited to what you do in your work. Whereas you can imagine if you install something on your phone, or if you have a wearable, we're collecting data about you 24/7. It could be your personal life, it could be during your work, and so on. And so it's really hard to sort of interpret that kind of data because it's super noisy. You could be doing tons of things. What if you've left your phone on the desk? What if it's on your pocket and we're not seeing, things? Or if you're left on your desk and you went out, does it mean that you are still at home? No, you left, right? But we don't know that. So asking people to actually provide us some sort of response to what we're collecting and whether we're true or not, or whatever the interpretation we're making, is it true or not? That kind of like basically having this sort of qualitative work go alongside quantitative work is important. Timing, like doing longitudinal study, is important. So yeah, all of this has helped me in my following work, follow-up work I've done, and I'm hoping that I can continue working in this particular domain, sort of understand these challenges better, understand what we can do with the technology we have, um, and hopefully, you know, even even if it's just trying to push the needle a bit, we end up doing something good. Yeah.
Awesome. Well, thank you so much, Subigya. It's been really insightful speaking to you today, and also hearing about the background, the motivation behind this work, some of the challenges, um, the findings, and also what we can do going forward, and also your personal takeaways from this study. So thank you so much again for talking to me today and being a part of the series.
Yeah, thank you so much for inviting me. I was super excited to share all of my learnings, and I would also like to thank all the folks that I got to collaborate with and who gave me this opportunity to explore such a important problem. And from my Microsoft research group, Javier Hernandez, who was my mentor, Mary Serwinski, who was the team lead, Hema Prafulchandra, Rahul Rojas, and all the other people that helped make this, uh, you know, um, come alive. And I think it's really important work, and I hope it leads to a lot of more, um, discourse in the community. I see there's a lot of things happening as well, thanks to you and several other folks that pushing forward in this direction. And again, if somebody listening to this, watching this is interested, please feel free to reach out. I'm happy to collaborate further in this area to learn more about the problem and to see what we can do together to help people. Thank you so much.
Thanks for listening to Mental Health and Cybersecurity, What the Research Reveals. I'm Dr. Kashyap Timaraju. And if you found this conversation valuable, please share it with a colleague or friend and join me in raising awareness about the people behind our digital security. Together, we can help strengthen the resilience and well-being of cybersecurity professionals everywhere. Thank you.